Your gums are disappearing right now, and your dentist has never explained the real reason why. Welcome to Real Health Logic, your source for evidence-based health insights that actually change your daily life. Two people, same age, same city, same dentist. One loses 3 teeth, the other loses none at all. The difference is not money, not genetics, not the toothpaste brand sitting on their bathroom shelf every night. It comes down to one simple 6-minute habit performed consistently every single night before going to sleep. Most people are asking the completely wrong question when they notice their gums slowly pulling away from teeth. They ask how to fix their gums instead of asking the far more important question of why first. Something is actively destroying your gum tissue right now, and surprisingly, it is not the bacteria themselves doing it. It is what those bacteria produce. Chemical signals that trigger your own immune system to attack your tissue. Your immune system does not target the bacteria directly. It attacks the very tissue it is trying to protect. This process is essentially biological friendly fire. Your own body misfires against itself every single night while sleeping. The recession you see in your mirror is your immune system slowly destroying the wall it was meant to protect. Now here is what published research actually says about an ancient remedy most modern dentists have completely ignored today. A 2009 study in the Indian Journal of Dental Research reviewed oil pulling across multiple clinical trials very thoroughly. The conclusion was genuinely shocking. Oil pulling matched the effectiveness of prescription chlorhexidine mouthwash in measurable clinical results. Chlorhexidine is the $40 prescription rinse dentists recommend. Oil pulling performed comparably, according to published peer-reviewed research findings. That study is now 15 years old, yet most dental professionals have never once mentioned it to their patients. The reason is straightforward. There is simply no billing code for a $3 bottle of cold-pressed sesame oil. The dental industry runs entirely on procedures and products, not on affordable kitchen remedies with strong published research behind them. In 2022, a major meta-analysis in the journal Healthcare reviewed 9 randomized controlled trials specifically on oil pulling results. One finding was consistent across every single trial. Harmful bacterial counts in the mouth were significantly and measurably reduced. Here is the critical gap every single one of those studies missed. Each one tested only one oil alone, sesame alone, coconut alone. Not one published study tested what Ayurvedic practitioners have combined successfully for 3,000 years. You simply cannot patent a kitchen remedy, so the most effective ancient combination was never properly funded for investigation. Now let us understand what sesame oil actually does when it moves around inside your mouth each night carefully. Sesame oil does not kill bacteria directly. It physically pulls bacteria away from your gum tissue like a roller. Think of bacteria as sticky burrs clinging to fabric. Sesame oil works exactly like a lint roller, removing them. The bacteria become unstuck and float freely inside the oil. When you spit, they exit with the oil completely. However, unstuck bacteria reattach to gum tissue within just minutes, meaning sesame oil alone only gives you partial results. This is precisely where clove enters the picture and transforms a partial solution into something far more therapeutically complete. 5 crushed cloves release eugenol, a compound that disrupts bacterial cell walls on direct contact, not weakens, fully disrupts. If sesame is the lint roller lifting bacteria off tissue, eugenol is what permanently destroys everything the roller picked up. Together they create a powerful sequence. Sesame lifts and exposes bacteria, then eugenol finds and eliminates them completely after. Sesame without clove allows bacteria to detach but survive, reattaching quickly and giving you only temporary and frustratingly incomplete results. Clove without sesame only reaches surface bacteria, never penetrating the protected hidden areas where the most harmful bacteria actually live. Here is an important point about why most commercial mouthwashes are actually making your long-term gum situation significantly worse daily. Alcohol-based mouthwash, kills everything. Bad bacteria, good bacteria, wiping out your entire oral microbiome in just seconds flat. The bacteria always grow back, but harmful strains colonize faster because that is their specific biological competitive advantage over beneficial ones. So you begin every single day with a mouth that is biologically working directly against your own gum health consistently. The sesame and clove combination works completely differently. It targets harmful bacteria specifically while allowing beneficial ones to survive normally. Think of it like a precise surgeon, rather than a bomb. Same mouth, but a completely different long-term outcome. Now here is the overlooked final step that most people skip, because it genuinely sounds too simple to matter much. Turmeric, the yellow spice already sitting inside your kitchen cabinet, is the essential and final piece of this protocol. Half a teaspoon mixed with an equal amount of water creates a paste applied directly to your gum line carefully. Here is exactly why this step is absolutely not optional and cannot be skipped without seriously compromising your final results. Your immune system has been misfiring for months or possibly years. That inflammatory response has built significant biological momentum now. Just because the bacteria are reduced does not mean your immune system automatically stops attacking your own gum tissue immediately. It keeps going like a car that continues rolling forward even after you have fully removed your foot off the gas. Turmeric contains curcumin, which sends a direct biological ceasefire signal to the immune cells attacking your own gum tissue nightly. A 2022 meta-analysis in Frontiers in Pharmacology reviewed 18 separate randomized controlled trials on curcumin's effect on gum inflammation specifically. Curcumin produced statistically significant reductions in gum inflammation, measured consistently at 1 week, 2 weeks, 3 weeks, and 6 weeks. This result was completely consistent across all 18 trials. That level of consistency in research is genuinely difficult to ignore. The oil combination clears the bacterial threat. The turmeric then calls off your body's own misfiring inflammatory troops completely. Both steps are fully required in that specific order. Skip either one, and the protocol delivers only partial, incomplete results. Now here is the complete 3-step nightly protocol with the exact sequence that must never be changed or skipped. Step 1. 1 tablespoon of warm water, mixed with 1 pinch of Himalayan salt, rinsed for 60 full seconds. This salt rinse creates tiny microcracks in the protective biofilm that bacteria build around themselves as a defensive fortress shield. Without completing this first step, the oil cannot penetrate that bacterial fortress at all, significantly reducing the protocol's overall effectiveness. Step 2. 1 teaspoon of cold-pressed sesame oil with 5 cracked cloves steeped for 30 seconds, then carefully strained. Cold-pressed is not a small or optional detail. Heat processing significantly degrades the active therapeutic compounds inside sesame oil. Add 1 tablespoon of water to thin the oil, just enough to reach tight spaces between your teeth and gums. Swish actively for 60 seconds during week 1, 3 minutes during week 2, and 5 full minutes during week 3. Always spit into the trash and never into the sink. Wait 60 extra seconds before rinsing so compounds keep working. Step 3. Apply the turmeric paste to your gum line using your fingertip in small gentle circles for 60 seconds. Wait 1 complete minute before rinsing. This contact time is what allows curcumin to meaningfully reduce your inflammatory response effectively. The full protocol takes exactly 6 minutes each night. Salt, then oil, then turmeric. Always done in that order. Here is the precise schedule recommended for your first 21 days, so your mouth adjusts without early unwanted sensitivity developing. Days 1 through 3. Perform only the salt rinse. Your mouth genuinely needs 3 full days to properly adjust first. Days 4 through 7. Add the sesame clove oil for 1 minute. Do not introduce the turmeric paste yet. Days 8 through 21. Perform the complete full protocol every single night without skipping any individual step whatsoever. 3 specific mistakes will completely undermine your results, even if you follow every other part of the protocol correctly otherwise. Mistake 1. Using alcohol mouthwash in the morning destroys the healthier bacterial environment you carefully built throughout the entire night. Use only plain water to rinse in the morning for the full 21 days to protect your overnight protocol work. Mistake 2. A medium or hard bristle toothbrush physically scrapes gum tissue that is actively trying to hold its position. Switch to a soft bristle brush immediately today. Angle it gently toward the gum line and let bristles do the work. Mistake 3. Stopping before day 14 because you cannot yet see any visible changes happening with your own eyes yet. The first real result is not visible at all. It is a feeling of reduced cold sensitivity between days 7 and 10. Most people quit right around day 10, stopping exactly 1 week before any visible results would have finally started appearing clearly. The tissue inflammation is already dropping during those early days. You simply cannot see that internal biological change happening yet. Now, let us be fully honest about what this protocol realistically can and cannot do for your gum recession long term. Lost gum tissue does not grow back on its own. Anyone claiming otherwise is only telling you what you want. However, recession is absolutely not automatic and is not simply an inevitable part of normal aging that you must accept passively. Recession is primarily driven by chronic, unaddressed inflammation. Address that inflammation consistently, and the recession stops. It does not merely slow. The tissue you currently have holds its position firmly. From tonight forward, it stops retreating any further than it already has. This is what 3,000 years of Ayurvedic practice already knew. The Charaka Samhita specified the oils, timing, and duration precisely. It recommended sesame oil moved through the mouth each morning for maintaining the health of teeth, gums, and jaw structure daily. This ancient text was written before toothbrushes existed, before fluoride was discovered, and long before any modern dental clinic ever existed. Researchers who studied populations practicing this daily ritual consistently found lower rates of gum disease compared to populations that did not. The scientists who published the 2009 oil-pulling findings specifically noted the practice warranted further controlled clinical investigation going forward urgently. That deeper investigation has remained slow because absolutely no company profits from combining sesame oil, turmeric, and salt together nightly. There is no pill to sell, no expensive device to market, and no monthly subscription attached to this ancient protocol whatsoever. You now have access to what the currently available published research shows, evidence that has been largely ignored by mainstream dentistry. If this information gave you a genuinely new perspective on your oral health, please give this video a like now. Subscribe to Real Health Logic so you never miss another evidence-based health insight your doctor may simply never mention to you.